Okay, folks, welcome back to Med Twitter this week. I'm Chris the Chiu Man Chiu, and I bring you this show every week to talk about my favorite tweets. Sometimes I have guests, sometimes I don't. I guess you'll find out. If you're watching this on Twitter, YouTube, or Periscope, please like and subscribe. If you're listening to this on Anchor Podcasts, and hopefully this will be distributed on other podcast platforms, please leave us a comment. So on with the show. Hit the intro. All right, guys, so my favorite tweet of the week comes from Dr. Shreya Trivedi. What meaningfully adds to a letter recommendation is, what is that med student like when no one is looking? Because in residency, no one cares about steps, their accolades, Twitter followers, etc. I really love this tweet, this thread tweet, and it actually, I think, goes together well with my episode from last week where we talked to Maximilian Cruz about looking at residency. So to help me talk about this more, I have Dr. Shreya Trivedi. Hey, Shreya.
Hi, everyone. Hey, Chris. How are you?
Fine. Thank you so much for taking time out of your day to talk with me about this. Do you mind telling me a little bit behind the reason of this tweet?
Yeah. I mean, like most Twitter threads happen when I'm supposed to be working out or doing something else, and I just ran across this awesome University of Arizona Women in Medicine. Their Twitter thread was around how do we decrease bias in letters of recommendation. Very, very important. But I think something in that made me reflect on when I see letters of recommendation, what I find really compelling about them. And I think, unfortunately, and correct me if this is also like your experience too, but I find that most letters of recommendation kind of like blend in, where you could probably change somebody's name and pronouns and you might kind of see the same kind of things said about somebody's patient presentations or the time they advocated for somebody, or how they are when they're doing clinical reasoning and things like that, or their accomplishments. And I think one of the few things that really jumps out to me, or when I'm writing a letter, is I try to think about, what is this person like when nobody's evaluating them? Because to me, that is one of the very, very, I don't tell me if this makes sense, but like one of the very few specific things that this person's going to be a good resident with good integrity. There's very few false positives when you kind of bring out, oh yeah, there was nobody giving him or her credit for this. Nobody was looking. And this person still went above and beyond when nobody told them to. And so I think that is, to me at least, like, that's a high caliber person.
Oh, I totally agree. I mean, I think it's interesting is because sometimes because no one's looking, sometimes you don't hear or find out about these things. I think one thing that happens, So I had a student, actually it was a group of students, and they did something special for one of my patients. We were on inpatient service, and a week went by. I didn't know about it, but then the senior resident came to me and was like, "Did you know blah 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 blah?" And I was like, "Oh, I didn't." And that's huge. And of course, I brought it up during their evaluations because I do like to do feedback Fridays, so I at least give them a formalized feedback once a week. But at the end of rotations, it's definitely something that I try to go over again. So. It's hard, right? It's hard to if no one's looking, how do we know?
The system isn't, I think somebody brought this up in like the Twitter comments too, is like our system isn't necessarily set up for that, right? Like we need letters of recommendations from attendings. The time you spend with your attendings is on morning rounds, and those patient presentations you can practice and perfect, and you don't really get to see the crevices of what someone's like when they're dealing with kind of more difficult situations. And I mean, to preface this, like med school is so hard, right? Like it's hard when you feel like you're being judged or evaluated. So like, don't want to add an extra thing to throw into the mix. But I think if you can get a glimpse of someone who when they're not told or not giving credit for something still rises to the occasion, then I think that's really meaningful to highlight. And I actually had a story, to me, when it really solidified, like, yes, this is so important to highlight. It was, if you don't mind me sharing.
Go for it.
Yeah. So it was actually when I was a senior resident. So I think that's the problem too, is that residents and other med students probably know a lot more about this person than the attending does, but the attending has to write the letter of rec. But I was a senior resident, and we had a patient come in with like profuse diarrhea, and it was just pretty bad. That this vet, who's like classically in clinic, like never complains about pain, never asks for help, he was actually like in tears, screaming in pain because he just had so much dermatitis and irritation around that area from, I forget what was causing his diarrhea, but it was pretty bad. And so our team had decided, okay, like let's put a rectal tube in to decrease the irritation around that skin. And of course, everyone in the hospital asked, was like, sorry, I don't know how to do it. That's not a part of my job. And I was like, okay, fine. So me and this med student, we YouTube how to put in a rectal tube. And we're like, okay, I think we got it. So we go in, we do it. I'm just like so relieved that like the balloon inflated. Like I think it worked. And I forget what happened, but like if I got a page or if there was another admission in the ED, but I quickly after that, like sigh of relief left. And mind you, this patient was like in an infection, like a infectious
contact precautions.
Yeah, I was like, what is it? How do you say? Like, what do I say? Oh yeah, but in a contact precaution room, so there was like 2 doors with windows, and I left, and then I realized like, oh, the med student didn't follow me, and so I was like, oh wait. So I went back in, and then he couldn't see that I could see him through the second glass door, but he actually was like cleaning up the mess we had made and putting the rectal tube box equipment back in the trash and cleaning up the area for the patient and the nurse. And it was just such a humbling moment for like 2 reasons. One, for me, because it took probably 30 seconds to clean up that area, and I was just like in my like to-do robot mode. But 2, like he didn't have to do that. He wasn't going to get credit the next day in his patient presentation that like, oh, by the way, I spent extra time cleaning up, you know. So my respect for him grew so much more. Like he was already such a great medical student to begin with. And so I actually put it in his evaluation, and sure enough, it made it to his like dean's ERAS application. And he said like every single, first he had no idea that I even put it in there or that like I'd seen that. But he was like, Shreya, every single OB-GYN interview I went on, everyone brought it up, and of course he matched his like first choice, and I just was so happy for him. But more so like, again, that like specificity of like, this is someone who has high integrity, like even when nobody's going to give him brownie points for it. And so it was a good way to like also pay forward, like I'm so happy that you are going to be a doctor, and how can I help you get there?
So, you know, besides accidentally happening upon seeing these, you know, unexpected things, and then, or asking other, you know, your residents on the team, like how else would you recommend attendings like me to find these things out and be able to give credit to these students for their letters? I
think like one of the things is also just having an honest conversation when you're writing a letter recommendation for someone, and kind of asking them like, what were those meaningful moments for you? And if those meaningful moments are like, I delivered amazing patient presentations and clinical reason, that's okay. But maybe they'll bring up some of these kind of intangible kind of moments that nobody really saw. And I think that could be a good way too. I think Kimberly Manning, a plug for her, she wrote an excellent tutorial last year on writing a letter of recommendation. And she, I think, very much encourages in her tweets, like kind of that back and forth conversation where she asks people, what are those like 3 things that you really want highlighted about you? So I think that's one way. Do you have any other ideas about that? I think it's something that I'm actively kind of.
No, I don't have a great way, but definitely open conversation with the student, because, you know, even though they're not getting brownie points, you know, it doesn't hurt to ask.
I kind of hate saying that.
Right,
sorry.
exactly.
It's so hard. Med school is so hard. Like prefacing all of this, it's so hard. It's
Agreed. I mean, so sometimes, I mean, I literally come out and I say when we're doing feedback, you know, not only do I give them feedback on their things, and I ask them for feedback on me, I also set the stage in terms of, you know, at the beginning of in a feedback session. I know I didn't expect this to become a feedback session discussion, but you know, I also,
it all goes back to feedback.
That's true. It's true. I usually preface on like what were the things they wanted to work on, but I also, not only that, so that if I want to know what they wanted to work on, I can give them feedback on that. but I also ask them what things did they do well, what did they enjoy doing, and what are the things that they're proud of. And so, maybe they may like offhandedly, especially if they're trying to be humble, may not say too much, but then if I catch it, I'll be like, can you tell me a little more about that? So that is one thing that I might try to do.
Right. Absolutely. I think that's what actually, as a med student, I literally created binders for every single letter writer of mine. And I gave them like 3 patient scenarios in case they had forgotten, in addition to my CV and my personal statement. And I was probably a little like over prepared. In retrospect, it's like, it's okay. You're going to be just fine.
I think that's actually important. Is I'm actually quite open. So when with my students and my residents, when they ask me about letters of recommendation, so the first thing actually I do is when I'm giving feedback, especially end of rotation, especially for med students who I know who want to go into like internal medicine or pediatrics, I say, I think you are an excellent student. I actually would be more than happy to write a letter of recommendation if you wanted me to when the time comes. So usually when people ask me for letters, it's not a surprise. I'm like, oh yeah, I remember I asked them for that. But then when they do ask me, or when I'm saying that I would write them a letter of recommendation during feedback or something or evaluation, I say, just know like writing letters are very difficult. So what we can do is we should also keep in mind things that we wanted to talk about. So even at that time, you'd be like, remember that case, when I was giving feedback, I'll remember the case, but 3, 4 months, half a year from now, I may not remember. It's like, this is something that I want to make sure that we highlight. And then I actually have a Google Docs that I start for everyone I want to write a letter on. And so hopefully I may start a vignette about like some of the things that they did. But then if I don't, I at least make sure that's in my evaluations, and I try to get copies of my evaluations later
That's great.
so that I can look at that. But then, when we're talking about letters of recommendation, I also say I want to meet with them. And I think Dr. Manning really sort of emphasizes this in her tutorial that she gave out last year was, when you're writing a letter rec, it's also an opportunity as a mentoring session. So she sits down, she talks to them. What are the things that you want to highlight? But then as when I go through things, I look at their personal statement, like, actually, that's great. Your personal statement sort of highlights this part. And then I'll look at their CV and it highlights this part. It's like, what can I do in your letter that I can highlight? And so I write these all as I'm talking to them, because I try to meet with them at least once or twice before I finish my letter, because, I get writer's block too. So as I'm writing, it's like, I don't know what else to say about this. And I try to meet with them a second time.
Yes.
So I think being open with them, because when you've agreed to write a letter, you want to write the best letter you can for them. Now, I know we were talking a little early before we started recording about what if you have the student you don't want to write a letter. Would you mind if I asked you how you've approached that situation?
I mean, I could, if anyone on Twitter wants to give me feedback on how to do it better, because I felt so uncomfortable afterwards. But I think the couple of times was when it kind of caught me off guard. It was like on like a week after working with this student, and just feeling like, I don't think I got to really kind of work with you enough to write you a strong letter of recommendation. And I think one of the feedback I gave to one of the persons, I said, I actually think you should ask somebody else, was, the next time you are on a rotation with someone, on that Monday or whatever that start date is, give them a heads up that, hey, I'm finishing up my ERAS applications. I'm really looking for like a strong one last letter recommendation. I'm really hoping I can work with you this week to kind of show you some of the unique skills I have. And then like that person's like on your team and it has that like on their radar. Whereas like it just caught me off guard, because I was like, I spent I think it was such a busy week. I think with that particular medical student, I'd spent like less than 20 minutes a day with, and totally caught me off guard.
So your advice is, at least from the medical student or even the resident who's applying for fellowship, like if they are in their mind, they're like the great Shreya Trivedi from Core IM and all the other fantastic things that she does, she would look amazing to get a letter from. Yeah. I should really tell her up front, like, I know I only have a week with you, but I really want to show you that I am the right stuff, and I really want to be able to earn this letter of recommendation from you. I just want
Yeah,
you to
because
know.
I think I would have gone like out of my way in the afternoons or something to spend more time with that medical student and kind of work on some of the issues that he was having over the week. But also, I felt really bad because when I was a fourth year med student, I did a dream away rotation at my dream residency program. And at the end of the rotation, I asked for a letter and I got a no. And it
And
was heartbreaking.
and definitely it can be. But I have to, we sort of talked about this too. I think you just have to be honest with the learner that asks you, and you don't feel like you can write them a strong one. Now, it's very possible they may never be able to find a strong letter from anyone, which I think happens.
Maybe they just write like 3 letters a year, and they're like, "Sorry, I filled my quota."
Right, but if a student comes, I have to be honest. If a student came to me and said, "Hey, I would like a letter of recommendation," and I'm like, I don't. A lot of times I will say I do not mind writing a letter of recommendation. I will write from my knowledge and my experience with you. I do not feel that I can write you the strongest letter that I think could be done for you. I would say, do you have other people you have in mind who could write you a stronger one? And if they're like, "No, Dr. Chiu, you're the only one I have that I think could write me something," I'll say, I'd be more than happy to work with you. It can also be a mentoring session with them. I can write to the strongest ability that I can, because I want to be on if I'm going to write a letter, I want to be honest and write the strongest I can with them. Now, if I have a learner who I just don't think I don't feel I could write even a good letter, I will just say, "I'm sorry, I haven't had enough time to really assess the full benefits, and I just don't think I could write it." I think you just have to be honest with people, because the last thing you want is, you also have to tell them, like, last thing you want is a bad letter, because actually that'll look bad. I don't currently sit on admissions for here where I'm at, but I have at previous institutions I'm at, and I remember doing a lot of interviews. And before the interview, I'd get a stack. I get a CV, and I get a personal statement, and I get their letters of recommendation. And I can tell you, I've seen many, as you discussed before, there are many stock letters of rec. They say the same thing. I'm sure they literally just change the name, and that doesn't help anyone.
Yeah.
And so I think that is something that it doesn't help you in any way, especially if you're really interested in going to a specialty. So, but then again, if the student is not really the strongest in those areas, I think it behooves them then, like in terms of mentor session, like, what are your strong suits? Like,
yeah.
So maybe you weren't the strongest while you're on inpatient medicine, but you worked really hard. You did like this free clinic or whatnot.
Yeah.
You get a letter from that free clinic person who helped you with that, and play to your strengths. So I think that would be the way I would do it, and say, I can help you, I can mentor you, but I don't know if I could write a letter for you. I think being honest like that is what I would do.
Yeah,
and have done.
It's so hard, but yeah, I'm proud of you for saying no. I feel like
so you haven't said no yet?
No. I mean, I've said no, but I think because I'm more of a novice letter writer, and I feel like I think I want to write the strongest letter, and I think if it's going to be a mediocre letter, I'd probably say no more than I should. But I feel like you're just so kind, you would say yes to everybody.
Well, no, I definitely have said no, but I think it's always there's always opportunity to teach a mentor. So
yes, absolutely, yeah. The one other thing I wanted to highlight that didn't get highlighted in that tweet thread, in terms of like highly specific things that are going to jump out in a letter that you're like, okay, this is a high quality person, is if someone says like, I would trust this person to take care of a family member. In addition to like when nobody's looking, this person is, goes above and beyond and is high caliber. I think that's one of the other things. And I think that maybe the people I've written letters for, I'm like, I would trust that person to take care of. I feel that line usually gets in there also.
I think that's a great line. And I think the reason why it's such a great line as well is because I don't know anyone who would lie about saying that.
Right.
Like,
you can't.
That is so, which is why I think when you're talking to patients about, when they, so, when we're trying to give patients, full autonomy and making decisions, and you're giving them, helping them with decision making, but you're trying to help them, they will ask you, like, what do you think I should do? And, I may say, I do not know the exact right choice, but if you were my father or my
Right.
mother, this is what I would do. That's the same reason why it holds the weight. Now, I mean, I don't know very many people who would lie about how much they care about their family, but, I guess it does happen too.
Yeah, the context. That's a good point. Oh, yeah. Awesome.
So I'm going to sort of shift up the script a little bit. So because I think Omel as well. So do you have any other tweets that you wanted to highlight from the week?
Yeah, there was one from my dear friend Utube on May 26th, and it was his first day of inpatient, and the incidences around the country had just, I think it's now the week is blurring, but it happened with Amy Cooper, as well as the police officer sitting on the person's, or kneeling on the person's neck. It was so tough. And I wrote this great tweet where he talks about his residency days when he remembers the injustices that happened to Freddie Gray and Michael Brown. And he remembers how things just kind of went on as business as usual. But now that he's an attending, he kind of asked Twitter, like, what do I say? And I thought it was just such a great tweet, one of reflection of what's going on in the world, but also himself now in a leadership role, and how is he going to change that for his team.
And it's really heartbreaking every time I see something like this, and unfortunately we see it more often than we should. It's just heartbreaking. And so we have a lot of systemic things that we have to work on, but I'm hopeful. We have such great people in the world who I think can help make a change. And I think the biggest thing that we can do as physicians, as members of society, is not sit by and let these things continue to happen, and to continue to keep the discussion open and make it known that this is not right. And even though it seems like we're shouting into a wind and no one's hearing us, I think as we continue to do it more and more, change will happen. I mean, change has happened throughout the course of American history, sometimes a lot slower than we want, but I feel we have such great people out there, people who are forces to be reckoned with, and things have to change. And I can only hope and pray that it will.
Yeah, absolutely. And I think one of the great things about Med Twitter is that we get to learn from each other. Sometimes you kind of feel like a little helpless in what you can do to advocate. And so just kind of seeing tweets like this, like, yes, let's take a moment of silence in our rounds. Let's, we can crowdsource from other people. Even when it's hard, and sometimes it's really hard to find the words, like, what do I bring up on rounds now as a leader? I want to bring up something. I don't want to just be silent and carry on as business as usual. And so I think it's a real blessing that we have our community on Twitter.
I agree. I mean, I think this is something that I've changed a lot in my practice, from becoming a senior resident to a young attending to, I guess.
Are you mid-career now?
I'm still a young attending, I feel. But rounds or even precepting clinic is more than just discussing differential diagnosis and treatment, because there's so much more to treating the patient, especially when we're looking as a whole, social determinants, health, everything that we're talking about. Like, physicians are usually, they don't want to talk about politics, but I do think there's ways to talk about social issues that are apolitical, even as much as other people may want to politicize them.
Right.
But I think those discussions are important because we are also human, and medicine encompasses everything. Social determinants of health, these all affect our own patients, and we have to be aware of them, and we have to discuss them often with our patients. I mean,
just as equally as sometimes we do like their management plan, like just like, great, throw them that aspirin and Plavix, but like if they live so far away from the pharmacy and can't get it, then like, or I mean, we're getting into the weeds of like other social determinants of health, but yeah, 100%.
So I think we could talk on forever on this, and I think I probably should have you back on again sometime.
Yeah. Were there any tweets you wanted to highlight from the week?
Yeah, so I do have some honorable mentions, and I just have so many of them. But I think I'm going to narrow it down to actually actually it's one topic, but multiple tweets. So it was really a recent clinical problem solvers where I think it was day 57. They've gone over 50. It's amazing that they're doing these virtual morning reports. That
awesome.
The guys over there, my buds, Reza and Robbie and everyone else.
And Moses. It was Moses. Yeah, I think it was Moses who led the idea. It was awesome. Med student. See, that should make it in his his letter of recommendation.
Totally.
Nobody asked him to go forth with it, but he,
That's amazing. And so the recent virtual grand rounds was May 27th, which on recording was just yesterday. It was about, I think, a presentation of seizure, but it ended up being prolonged QT syndrome. Oh. And so not only was that a great virtual morning report, but then Travis Smith, who I think I brought up now 3 times in a row now, did working on a space repetition, did another great thread talking about it. One of my colleagues here at OSU, Vig Doraiswamy, also had a discussion about long QT, and then Reza also had a tweet thread, and I will put those all down in the description on the videos and thread it in the tweet from this one. But that was one of my favorite things to watch, and it literally just happened in the last 2 days. And the collaboration, I think Vig's tweet has over 100 likes and 31 retweets. Travis's had 30 likes and 8 retweets, and people are just gobbling this up. And it's just amazing that we're learning this way, that we're having such, now's the time, we're now within the age of COVID, any type of, just like in war, I know we're done with all the war analogies, but they become crucibles where we make all these great leaps in technology and advancement, and medical education is one place. And I think between virtual morning reports, and doing podcasting, which we obviously love, and we're all definitely we're in the thick of some research. I know we're all part of some of these teams. Hopefully these are ways in which we can definitely improve medical education, and this is one of the great things. So I'm so happy to have seen this, and I wanted to highlight that.
Yeah, and what you're highlighting is that Vig and Travis, they're amplifying, they're adding, and it's great to learn from so many perspectives, and so props to them.
Totally. So I think we've talked a long time. I just want to make sure that, is there anything you want to plug before we go away?
I hope everyone's taking care of themselves.
Me too. But follow Shreya, which you probably, if you're watching any of this, you probably already follow Shreya way before me or anything else. And also Core IM and all the other great projects that she does. I know she's a chronic staple on the Women in Medicine chat on Sunday nights as well, which I tend to lurk on and watch because I think I learn a lot from those as well. So thank you for being with me today, Shreya. I really appreciate it.
Such a pleasure. Happy Thursday, or I guess happy Friday to the world tomorrow. But take care.
All right. And so make sure everyone, so thank you for watching along. Like I said, like and subscribe here on Twitter, Periscope, YouTube, follow MedTwit This Week on Twitter, and, subscribe to the podcast whenever it comes up on Apple Podcasts. So thanks everyone. Bye.